Today is April 15th, fast coder 21s, pre CPC, SDS, ASC YouTube live session 14, integumentary system, coding scenarios. So today is our first question. 26-year-old male had a previous biopsy that indicated positive malignant margins anteriorly on the right side of his neck. So a 0.5 centimeter margin was drawn out and a 15 blade scalpel was used for full excision of an 8 centimeter lesion. Layered closure was performed after the removal. The specimen was sent for permanent histopathological examination. What are the CPT codes for this procedure? So we have options 11,626, 11,626 and 12,004, 11,626, 12,044, 11,626, 13,132. So now it is 9:31. So we will start the answer at 9:35. So Prasanjit, I have already posted our Telegram link in the channel. So can you see in this chat you can find that. Can you see that? Otherwise, no worries. I will post it again. So now you can see you can join there. So if you are trying for the jobs or any videos, we can find from there. And if it is possible, just share it to your friends also. So our intention is to as much as help the coders. Hi Manju, started searching the code. Great, great Prasanjit. Take care. So now dive into question. So as you know, these today we are going to discuss integumentary session. So see the question and find the answer and mention in the chat box. So we will start answer at 9:35. So our intention is pure, just we need to help the people. So nothing more than that. So frankly speaking, along with helping you, I am also learning. So why means education is ocean. So in order to stay in medical coding, you need to keep update with latest guidelines and you need to have good follow up of our CPT book. Yeah, most of the people wrote correct answer. One minute, guys. There is a technical problem here. So meanwhile, yeah, you are correct, Algar. All are doing good. 1 second, here system is very slow for me. But your answer is correct only. So as it is a direct question, not that much complicated. Yeah, we will check 11626 first. 11626. Yeah, first we will analyze the question, then we will discuss the answer. So basically here patient is 26-year-old male, has previous biopsy that indicated positive malignant margin. So malignant margin means obviously patient has malignancy anteriorly on the location of the malignancy is on the neck. So a 0.5 cm margin was drawn out and a 15 blade scalpel was used for full excision of the 8 centimeter lesion. So here this is a keyword, and one more keyword is layered closure. So this one we need to code. So the specimen was sent for permanent histopathologic examination. What are the CPT codes for this procedure? So we will check 11626 first. So what is this? 11626 is for excision, malignant lesion including margin, scalp, neck, hands, feet, genitalia, excised diameter 0.5 centimeters or less. And based on our question, our malignancy size is more than 4 centimeter. So we can code 1111 626 here. So our primary code is correct, 11626. And also we need to check the layered closure. Basically, as per the CPT guidelines, so repair of an excision of malignant lesion requiring intermediate and complex closure, we need to code separately. So in this question, physician has used layered closure. So here we need to code intermediate closure. So based on this rationale, A is wrong. Why means here there is no intermediate closure code. So D is also wrong. So 13133 for, so we will check 13133. What is that? 13133. So 13133 for not malignancy, I think. So repair complex forehead, cheek, chin, mouth, axilla, and this is complex repair. So in our in our question, physician has performed layered closure. So it is intermediate repair. So we need to code intermediate repair only. So D is also wrong. A is also wrong. So we are left with only two options. So we need to check 12004 and 12044. So 12004 and 44. Here simple repair. See 12004 is for simple repair. So we need intermediate repair as it is a layered closure. So we need to code this one 5.1 centimeter to 44. So see here repair intermediate. So here we need to code 44. Where is 44? Here. If you check the location, this is the intermediate repair of wounds of neck, hands, feet under external genitalia. 44 is 7.6 to 12.5 centimeters. So our lesion size is in between 7.6 to 12.5. So we need to code 12044. So as here physician has performed multiple procedures, we need to use 51 modifier. So here our answer is 11626 and 12044 51 modifier. So I hope most of the people wrote correctly. Yeah, all are wrote correct. Hi Parimala, good evening. Thanks for coming. So I hope everyone got this answer. Anyway, it is easy only. So basically here, what are the guidelines in this question is for malignant lesions, simple repair is included in the code description. For along with malignant lesion, we need to code intermediate repair and complex repair additionally. So because of that reason, we have coded 11626 1200 12044. You need to remember only one thing. So simple repair is included in the malignant lesion excision. Intermediate and complex repairs are not included in the malignant lesion excision. So we need to code them separately. So for that reason, we have coded here separately. Yeah. Thank you, Prasanjit. Yeah, 8 centimeters. Hi, Parmila. You are doing good, I hope. So I will go ahead with second question. 25-year-old female is having 15 square centimeter debridement performed on an infected ulcer with escarron on the right foot. Using sharp dissection, the ulcer was debrided all the way to down to the bone of the foot. The bone had to be minimally trimmed because of sharp point at the end of the metatarsal. After debriding the area, there was minimal bleeding because of very pure circulation of the foot. It seems that the toes next to the ulcer may have some involvement and cultures were taken. The area was dressed with sterile saline and dressings and then wrapped. What CPT code should be reported? So you have options 11043, 11012, 11044, 11042. So now it is 9:42. We will start discussion of this at 9:46. So just to first to try to find the keywords here, then you can write the answer easily. So as I told you before, if you are working as an ambulatory coder or if you are trying for CPC exam, most integumentary system is the most important and scoring chapter. So you need to have good understanding of guidelines in integumentary system. Nothing, just you need to compare the code description with our scenario performed. Nothing secret here. So we need to know how to compare. So this week, few of our coders joined previously in these sessions are going to write CPC exam. So we need to tell them best of luck. So they have attended these sessions previously. So as time is shortage for them, they have not attended today. So we have 2 more minutes. Guys, try to write any answer. No worries. It is not an exam. Just you will get good idea. So whether you can write anyone, A, B, C, or D, whatever you think is correct. Oh, great. Good company. I think Ajuba is in Hyderabad also. Clarity. Hi, Drakshayani. Good evening. Yeah, good Manjur. You are doing good. I hope today all questions are very easy only. Hi Yasin. Good evening Yasin. So क्या प्रॉब्लम है गौरव? क्यों रीड नहीं हो रहा है? So आप नहीं देख रहे थे? So I hope everyone can see the document. So we have completed only one question Yasin. So we can start try with other questions now. So now we are doing second question. So you can try for second question. Not a problem. Anyway, you can do. I know about you. It is not a big deal for you. So guys, time over now, 9:46. So what happened your result Yasin? So are you waiting for result? I hope you have passed now. So what is the result? So mention in the comment section. So meanwhile, oh great. Yeah, just now I told few people, our friends that we have few people previously attended. They have attended for. So is these sessions are useful as in for you? So do we need to develop any other way? So these sessions are useful. How do you feel? But Gaurav, most of the people can see the document, Gaurav. I can't do anything. So, so anyway, now time 9:48. We will go ahead with. Thank you, Yasin. Thank you very much. Yeah, as I told you before, I will try to explain CPC point of view as well as the ambulatory surgery coding point of view. So if anyone visits or watch these videos, they can work for ambulatory surgery coding as well as they can write CPC exam also. So even that's why our heading also CPC, SDS, ambulatory surgery coding. Anyway, thank you Yasin for your appreciation. So help your friends to attend these sessions and get help from Fastcoder 21. So anyway, congratulations guys. All of you tell congratulations to Yasin. Thank you Yasin. Thank you very much. I hope you will continue to attend like this way. So I will not stop. I will continue these sessions every week, surely. Yeah, yeah. Okay, guys. Oh, thank you, Yashin. Thanks for appreciation. So try to attend every session every weekend so that you will get good idea about ambulatory surgery now. Anyway, CPC is not needed for you. So if you want to go in ambulatory surgery or like same day surgery, both are same only. But you can these sessions are very useful. So anytime if you miss these sessions, you can watch live fast coded 21 videos also. Yeah. No worries. Go ahead. We will start with the keywords first. So here 25-year-old female is having 15 centimeter debridement. So in debridement, we need to check this how much debridement is performed on an infected ulcer. So this is infected ulcer is the medical necessity with eschar on the right foot. So location is also important. Sorry guys, we don't know. I think this is Malayalam or Tamil. I don't know. We know English or Hindi. Yeah, thank you, Prasanjit. So using sharp dissection, the ulcer was debrided all the way down to the bone. So in debridement, one of the most important interview question as well as the keyword is how much the debridement is done. So what is the depth? Is it skin level, muscle level or bone level? So based on our question, here debridement performed until the bone. So bone of the foot. The bone had to be minimally trimmed because of a sharp point at the end of the metatarsal. So after debriding the area, there was minimal bleeding because of very pure circulation of the foot. It seems that the toe next to the ulcer may have some involvement and culture were taken. So these are not necessary for us. So we will check first 11043. So what is 11043? So as I told you before, while coding debridements, we need to remember and we need to check the keyword what depth physician has performed the debridement. That is the important concept here in debridements mostly. So debridement, muscle and fascia, first 20 square centimeters or less. So based on our question here, debrided until the way down to the bone. But 4-3 is for debridement, muscle and or fascia only until the fascia. So 11043 is wrong. So we will check 11012. So see here, skin, subcutaneous tissue, muscle fascia, muscle and bone. But here we need to check the stimulus foreign material. But basically in our scenario there is no fracture location. So debridement not performed at the fracture location. So 11 this is also wrong. 11012 is also wrong. Why means this debridement is performed at the open fracture location. But in our question there is no fracture. So 11012 is also wrong. We will check 11042. So what is 11042? Debridement, subcutaneous tissue. So 40 is subcutaneous tissue. So we will check. We are left with 11044. So here debridement bone includes epidermis, dermis, subcutaneous tissue, muscle and or fascia if performed first 20 square centimeters or less. So based on our question we have only 15 square centimeters. So based on this rationale our correct answer is 11044. So basically you need to understand that our skin layers includes first epidermis, dermis, subcutaneous tissue, muscle and or fascia, then bone. So you need to remember like this way. First is epidermis, dermis, subcutaneous tissue, muscle and or fascia, then bone. Yeah. I hope everyone got this answer and wrote correctly. Guys, we don't know Malayalam or Tamil. Please write in Hindi or English, guys. Sorry for that. Even you can write Telugu also not a problem, but we don't know your language. Yeah, we will go ahead with Hi Shivangi. Good evening. Welcome to Fast Coder 21. So today we are learning integumentary system coding. I hope this session is very useful for you. I hope you have the CPT book along with you. If you want to participate without any hesitation, you can write your answer in the chat box. So we will go ahead with third question. A 44-year-old male who has multiple sclerosis fell from his walker and landed on a glass table. He lacerated his forehead, cheek, and chin, and the total length of these lacerations was 6 centimeters. His right arm and left leg had deep cuts measuring 5 centimeters on each extremity. His right hand and right foot had a total of 3 centimeter lacerations. The ED physician repaired the lacerations as follows. The forehead, cheek, and chin had debridement and cleaning of glass debris, with the lacerations being closed with one layer closure, 6 prolene sutures. The arm and leg were repaired by layered closure, 6 vicryl subcutaneous sutures and prolene sutures on the skin. The hand and foot were closed with adhesive strips. Select the appropriate procedure codes for this visit. So you have 9920831210 like this. So we can find the correct answer for this question. So this is bit complicated. So now it is 9:56, 9:57. We can start the answer discussion at 10:05. So if you find more answer, we can start. So first try to understand the repairs and first like in simple, intermediate and complex. Then you need to find the location and then you need to find the centimeter of the laceration repair. So these are the keywords. Yeah, no worries, Parmela. You are doing good. Yeah, sure, Sivangi. Meanwhile, we have sessions until I think respiratory system. So you can watch those videos. So next week we will keep one poll in our WhatsApp groups and Telegram groups. So based on that, we can decide. So even I too have the intention to start ICD-10 guidelines. So we will keep poll next week, and next week we will go ahead with ICD-10 CM. No worries. So if anyone wants to join here in our Telegram groups, you can join. If anyone visiting for the first time, so where you will get free videos as well as the coding related PDFs, and also you will get or you will find AAPC free webinars. Basically, our groups are all-rounder groups. You will get everything. So if anyone wants to join in our Telegram group, link provided in the chat box, so we can join there. So Shivangi, are you from India? Yeah, I think you could open. Now also people joined. One Prasad joined the group via invite link. Now also people joined. Nearly we have 1100 people in our Telegram group. Sorry, 1100 coders. Yeah, yeah, yeah. Thank you, Shivangi. So last week we have posted one video related to how to find medical coding job in US. So I think that session is useful for you if you are looking for a job. Otherwise, if you have any information needed, so daily same session, Shivangi, 9:15 p.m. Saturday and Sunday. So this is the 13th session. Basically, every week 9:15 we will start. Yeah, yeah. Currently we are providing medical coding trainings for US people also, and we are providing CPC and CPMA training also. We are providing trainings. Currently, we are providing trainings for US, UAE, and India. So, if you need any assistance, just you can send your details to your concern to Vincent Medical Coder @gmail.com. So even we are posting some job openings in US also, Shivangi. So if you join in our Telegram group, you can find suitable job based on your experience. Previously, we have posted few jobs from Texas, I think. Yeah, yeah, Saturday and Sunday. So one second. So we have some regular coders from US also. They every time they used to call me and they will clear their doubts. Yeah, in Texas we have most of the Indians. Even I have students from Texas only. Most of the Indians are in Texas. Like mostly like medical coders in Texas only. Indian medical coders. So go ahead. We don't waste our time. So I hope I did not get any answer for this question. So anyway, I will go ahead with our session. So here, as soon as we see this question, we need to find the keywords. So like centimeters, these locations, and what else? Type of repair performed. So here debridement performed, and here these are the centimeters, and these are the locations. So these are keywords while performing laceration repairs. So the forehead, cheek, and chin hair debridement and cleaning up glass debris is the lacerations being closed with one layer closure, 6O prolene sutures. The arm and leg were repaired by layered closure. So basically, based on CPT guidelines, If the laceration is closed with adhesive strips, we no need to code those adhesive strips coding. So these are included in the E&M code. So we can eliminate A and B here. So we no need to code adhesive strips code as these are included in the E&M code. Next one is C. So basically, based on CPT guidelines, when the physician performs laceration repair along with debridement and cleaning up debris with the laceration closed with one layer closure, we can code it as intermediate closure. So here we need to code 12034. So here C is also wrong. So here it is provided simple closure. So if the simple closure complicated by providing debridement and cleaning up glass, we need to code it as deb like intermediate closure. So because of this rationale, our answer is 9928325 12053 12034 59 modifier. So 59 is for separate structure. So this intermediate repair at forehead, cheek and chin, and this one is at arm and leg were repaired by layered closure. So these two are different locations. We need to use 59 modifier. Hi Yamuna, good evening. So here our answer is D 99283 25 12053 12034. So I hope everyone got this answer. Yeah, Parimala, you are doing great. So you have more concentration on integumentary system. So you are doing good job. If you write your CPC, best of luck for that. So we will go ahead with question number 4. So pre-op diagnosis, left breast abnormal, MMX or palpable mass, other disorders of breast. Procedure performed is automated stereotactic biopsy, left breast. So findings. So whenever you see a operative procedure, you need to check the findings also. So what happens in findings? After the completion of the procedure, physician will mention what are the or what are his or her observation in the surgery. So while coding, whether in CPC or ambulatory surgery coding, findings also very important. Why means, for example, if there is a fibroid here or any type of dimensions, so they will mention in findings section. So you need to read the findings also along with the description of the operative report. So here lesion is located in the lateral region just at or below the level of the nipple on the 90 degrees lateral view. There is a subglandular implant in place. So here you need to find the code for automated stereotactic biopsy of left breast. So these are easy only. So you need to find the keywords first, then you need to find the answer. So your options are 19081, 19283, 19081, 19100. So now it is time 10:09. So we will start discussion at 10:13. So breast section is little bit confusing. So why means in breast biopsy we have multiple guidance like stereotactic guidance, fluoroscopy guidance, ultrasound guidance, mammography guidance. So you need to check the code descriptions properly in order to code properly. First, try to identify the keywords in the report. So then you can write the answer easily. So no need to worry about the answers. Just write whatever you know. So your question here is breast biopsy using stereotactic guidance. So you can see properly now. Yeah. Good job, Parimala. And one of our friends, Yasin, passed the exam. So she got good marks only, 79%. So she is one of our student for the past few sessions. So if anyone wants previous sessions, you can watch on past quarter 21. So all are recorded and all are live now. You can watch them whenever you have the free time. Yeah, good Algar. You are doing good. So meanwhile, if you feel these sessions are useful, please click on like button once and also encourage your friends to attend these sessions freely to know more about this coding or CPC or ambulatory surgery. So now time is over. We can start the discussion. So first we need to find the keywords here. Our location is left breast, okay. And medical necessity, there is a mass here, palpable mass. And physician has performed automated stereotactic biopsy left breast. So here what happened, discuss the and including risk, possibility injury, patient has signed the consent, the patient is prone on the, see here, stereotactic table. This is the keyword here. The left breast was then imaged from the inferior approach. The lesion was interest is the anterior portion of the breast from the implant which was displaced back toward the chest wall. After imaging was obtained and stereotactic guidance here confirmed, physician has stereotactic guidance used to target coordinates of the biopsy of the left ear prepared with betadine. These are local anesthesia basically. So everything is, so here CNO-RX needle is the keyword here. Under stereotactic guidance was obtained. The specimen radar confirmed representative sampler qualifications were removed. The tissue marking clip was deployed into the biopsy cavity successfully. This was confirmed with final stereotactic digital image. The clip was visualized protecting over the biopsy site was dressed with OK. See successful stereotactic core biopsy of the left breast calcifications. Tissue marker. So pathology report is pending and addendum will be issued after we receive the pathology report. So here basically what happens, so physician will write stereotactic biopsy left breast here, but physician originally will perform, not usually, but sometimes they will use the mammography guidance here. So in order to reduce this conflict information, we need to find the keywords in operative report. So you need to remember that whenever we code, so operative report is the golden document, not procedure performed. So we need to code based on the operative report, not based on the procedure on the heading. So always we need to concentrate on operative report. So Based on our operative report, physician has used stereotactic guidance. So now we will check the answers. So we will check 19283 first. 283. So meanwhile, you can write the answers also, not a problem. So what is 19283? Placement of blessed localization device, clip metallic pellet, wire needle, percutaneous first lesion, including stereotactic guidance. So basically here what happened, clip is already placed. So here physician is performing only biopsy. So we can eliminate 19283 here. So what happened in breast surgery? So initially radiologist perform the clipping, like he will mark the lesion in the radiology laboratory. Then they will send the patient to the operating room. Here plastic surgeon will take biopsy or excision of those lesions. So usually radiologist will perform the or identify the lesion using the radiologic guidance. So next one we will check 190. So as we have checked that 19283 for placement of breast localization device, we can eliminate B, C, D as 19283 is included in all these three codes. So here our answer is 19081. We will check why it is. So why 19081? So see here, biopsy breast with placement of breast localization device, clip metallic pellet when performed. So this localization device placement is not necessary. If physician performs localization also, we need to code this code. And imaging of the biopsy specimen when performed percutaneous first lesion, including stereotactic guidance. So in this code, physician may perform placement of the localization device, biopsy of the breast, and he will use stereotactic guidance. So all these three procedures will be performed in only one code. So because of that reason, our answer is 19081, which is A. So I hope all wrote correct answer. Yeah, Imna wrote correct only. So Parimala, you need to understand this. So 19283 for only localization device. So if you check 19081, this is used for biopsy as well as the localization of the device as well as the stereotactic guidance. So all these performed in this session all included in 19081. So if you check the description of 19081, it includes biopsy, breast localization device when performed and stereotactic guidance. So our answer is 19081. I hope Parmela and Algar are clear now. Okay, so we will go ahead with another question. So 73-year-old male is in the dermatologist's office for removal of two lesions located on his lower lip and nose. Lesions were identified and marked. The lower lip lesion of 4 millimeters in size was shaved to the level of the superficial dermis. Utilizing 3 mm punch, a biopsy was taken of the left supratip nasal area. What are the CPT code for these procedures? So 11100, 11310, 17000, 11440. So now it is 1020. We will discuss the answer as 1024. So you don't need to worry about the right or wrong. So if you don't understand this session, you can watch this session after also. not today. As soon as we complete, tomorrow you can watch again in the YouTube live videos section of the Fast Coder 21 if you don't understand now. So if you have any doubt, you can mention in the comment section on YouTube videos. We will try to answer those. Purely our intention is to help the coders, nothing else. So because of that reason, we are performing these sessions for the last 1.5 months. So far, 2 students has passed the CPC exam. First one is Rohit, second one is Yasin. This week, 2 more people are going to write. Uh, They will tell their result next week. So I think people are not interested this session. So can we stop now? So as I am not getting any answers here. So if you want, we can stop here. So I did not get even one answer now. Thank you, Manjur. Thank you. So see here, this is a free session only. If you are interested, you can attend. So anyway, Manjur has replied with B. So we will check the answer now. So what are the keywords here? 73-year-old male is in the dermatologist's office for removal of 2 lesions located on the lower lip and nose. So here we need to find the locations. Lesions were identified and marked. The lower lip lesion of 4 millimeter in size was shaved to the level of the superficial dermis. So first one is shaving. So utilizing a 3 mm punch, a biopsy was taken of the left supurative nasal area. So second procedure is biopsy, punch biopsy. So first one is shaving, second one is punch biopsy. So we will check the answers now. We will check 11100. What is that? So I think we can't find that code. I think that is older paper. 11100. Oh, let me check once. So currently I'm using 2022 book. So I can't find 11100 here. You check here. It starts with 11102. So directly we can eliminate A. 11100 and 11101. So we are left. We will check 17000 now. So basically, what is it is? Sorry. So basically, it is a distraction pre-malignant lesions like actinic keratosis. So, but based on our question, it is not actinic keratosis. So it is. So we can eliminate 17000, which is C also, and we will check 11440. See excision, other benign lesions including margins except skin tag, face, ears, eyelids, nose, lips, mucous membranes, excised diameter 0.5 centimeters or less. So basically, in our question, physician has performed punch biopsy and shaving. So, but this code relates to excision. So we can eliminate answer D also. So we are left with answer B. We will check 11310. If you see 11310, we are coding this for lip lesion of 4 millimeter size, shaved to the level of the superficial dermis. See here, shaving of epidermal or dermal lesion, single lesion, face, ears, eyelids, nose, lips, mucous membranes, lesion diameter 0.5 centimeters or less. So based on our question, you need to remember that shaving questions are in centimeters in CPT. So here they have provided millimeter. So you need to check this whether question is having millimeter or centimeter. So these are the most important tips you need to remember in integumentary system. So what means based on millimeter, centimeter, square centimeters, we have code descriptions. So here our 11310 is for 0.5 centimeters or less. So but ours is only 0. Sorry 4 millimeters. So we can choose 11310 is for shaving until epidermal, shave it to the level of the superficial dermis. So again, now we need to code punch biopsy. So we will check 11100. So anyway, those codes are changed now. So we need to choose other question now. See here, these are the punch biopsies. So we need to code from 11104 or 11105 series. We will check once. See, punch biopsy of the skin, including simple closure when performed. So you can code 11104 instead of 11100. So 11100 is deleted in 2022 version. So based on this, our answer is 111 B, 11310 and 11100. So our next question we will check. So I hope I got only few answers. Yeah, most of the right. Yeah, I can't find that code formula 11100. So I think most of the people write correct answer only. Yeah, no worries. Good job. Hi Srinath, good evening. So please click on like button in order to motivate me and continue these sessions further. So this will create more impact on me if you click on like button if you like this one. So now we'll go ahead with question number 6 of the day. A 46-year-old has dermatochalasis on bilateral upper lids. A blepharoplasty will be performed on the eyelids. A lower incision line was marked at approximately 5 mm above the lid margin along the crease. Then using a pinch test with forceps, the amount of skin to be resected was determined and marked. An elliptical incision was performed on the left eyelid and the skin was excised. In a similar fashion, the same procedure was performed on the right eye. The wounds were closed with sutures. The correct CPT codes are 15822, 15823, 15822, 15820. So now you have, it is 10:32 now. We will start the discussion at 10:36. So whenever you see any diagnosis, you need to find what is the diagnosis. So in CPT, based on diagnosis also, you will find the CPT code. So you need to research what is that diagnosis and what is the purpose of that procedure. Yeah, no worries, Paramila. You can use 2022 also. Yeah, good Manjur. Yeah, great. Yeah, yeah, good Srinath. So now we will discuss answer. So 46-year-old has dermatochalasis. So what is dermatochalasis? So basically it is a condition where upper eyelids will swell on bilateral upper eyelids. So this condition usually occurs on upper eyelids. So a blepharoplasty, yeah, as all of us know, blepharo means eyelid, plasty means repair. So eyelid repair will be performed on the eyelids, yeah, as usual. A lower incision line was marked at approximately 5 mm above the lid margin along the crease. Then using a pinch test with forceps, the amount of skin to be resected was determined and marked. So basically what happens here, physician will remove the excess skin on the eyelid. So see here, amount of skin to be resected and marked and he removed. An elliptical incision was performed on the left eyelid and the skin was excised. In a similar fashion, the same procedure performed on the right eye also. So here procedure was performed on both eyes. The wounds were closed with sutures. So we will check the one by one. So what is 15820? So it is 15820 is for blepharoplasty lower eyelid. But based on our question, patient is having blepharoplasty on upper eyelid. So directly we can eliminate D. 15820 D we can eliminate directly. So without seeing anything. So next we will check 15822 and 15823. So here only all are. So as I told you, for some condition using the diagnosis also you can find the CPT code here. So what is 15822? Blepharoplasty upper eyelid. So 23 with excessive skin weighing down lid. So for bilateral blepharoplasty we need to add 50 modifier. So based on our scenario, physician did not mention that excessive skin weighting down lid. So he did not mention that patient has excessive skin which we have excised. So here based on the operate report we can't code 15823. We need to code 15822 blepharoplasty upper lid and for bilateral procedure we need to add 50 modifier. So because of this rationale our answer is C. As in 823 documentation did not contain what is this excessive skin. So if the documentation contains excessive skin, we can code 15823. But documentation does not have patient is having excessive skin. So we need to code 15822 50 modifier. Okay, I hope everyone right. Yeah, most of the people write correct answer. So Prasenjit, Srinath, Manjur need to think about. Srinath is also correct. So Manjur and Prasenjit need to think about this. So B, whenever we code B, in order to code B 15823, we need to have a keyword of excessive skin along with blepharoplasty. So that time we can code B. But based on our documentation, there is no keyword of excessive skin. So we need to code 15822, normal procedure. So it's better. We can go ahead with question number 7. So patient has basal cell carcinoma on his upper back. A map was prepared to correspond to the area of skin where the excisions of the tumor will be performed using Mohs micrographic surgery technique. There were 3 tissue blocks that were prepared for cryostat, sectioned and removed in the first stage. Then a second stage had 6 tissue blocks which were also cut and stationed for microscopic examination. Oh, no worries, Manjur. So just we need to understand the keywords. So if you understand the keywords, you can write easily. So your thinking is correct, but we don't have any word mentioning that excessive skin. Yeah, because of that reason, we need to code normal code only. So then entire base and the margins of the excised piece of tissue are examined by the surgeon. No tumor was identified after the final stage of the microscopically controlled surgery. So you have option 17313, 17313, 17260, 17313. So now it is 10:40. I will give you 4 minutes. We will discuss the answer as 10:44. So first try to identify the keywords, then write the answer. So basically you need to find the keywords first, then you need to check the codes. So if anyone wants to go Singapore, watch the video. We have published it today. So if anyone wants to go Australia, next week we are going to publish best tips to find medical coding job in Australia. You can watch that video. So currently we have published best tips for United Kingdom, UAE, Canada, and Singapore, USA. So only we are left with Australia that we are going to do in next week. Yeah, great. All of us know most of the people wrote correct answer. So we will discuss the answer here. So basically most micrographic surgeries performed for carcinomas. So here location is upper back. So in order to make most micrographic surgery, physician needs to map the area. So this is the keyword here for us, most micrographic surgery. There were 3 tissue blocks that were prepared for cryostats and removed in the first stage. So first stage, 3 tissue blocks. Then a second stage had 6 tissue blocks, which were also cut and stained for microscopic examination. The entire base and margins of the excised piece of tissue were examined by the surgeon. No tumor was identified after the final stage of the microscopically controlled surgery. What procedure codes reported? So basically here, patient is having most micrographic surgery based on our question. So here directly we will eliminate answer C, which we will check. So what is this? 172. We need to remember that most surgery codes all under 17,300 series only. So directly we can eliminate 17260. We will check what is that 17260. This is distraction. So while coding CPC exam, you need to remember the most micrographic surgery code series. So if you know the series, directly you can eliminate C here. So we can eliminate C. So here physician has performed first stage with 3 blocks and second stage with 6 blocks. So we need to check 17313 first. So basically most micrographic surgeries are based on anatomic grouping, the number of stages taken and number of blocks per stage. So now we can check that. So here 17313 for first stage with 3 blocks. So our location is here is back. So if we check trunk, Back comes under trunk. So we can take this one. First stage up to 5 tissue blocks. So for first stage we can code 17313. As in our question we have only 3 blocks. So we can code 17313. In our second stage we have 6 blocks. So if you check 17314, each additional stage, here you can consider it as second stage after the first stage up to 5 tissue blocks. But based on our question, we have 6 tissue blocks. So remaining 1 tissue blocks, we need to add our code add-on procedure 17315. So this is for each additional block after the first 5 tissue blocks. For example, if you physician has performed 7 tissue blocks, we need to code 17315 times 2. Why means here it is mentioned as each additional block. So here our answer is 17313, 17314, 17315. So most of the people wrote correct answer only. Well done, guys. So initially most micrographic surgery bit confusing, but if you got the good understanding of this surgery, you can write code it easily. So I hope most of the people write correct answer this one. So no need to concentrate more on this. So next question. 65-year-old male is in outpatient surgery to excise basal cell carcinoma of the right nose and have reconstruction with an advancement flap. The 1.2 centimeter lesion with an excised diameter of the 1.5 centimeter was excised with a 5-number blade scalpel down to the level of the subcutaneous tissue, totaling a primary defect of 1.8 centimeter. Electrocautery was used for hemostasis. An adjacent tissue transfer of 3 square centimeters was taken from the nasolabial fold and was advanced into the primary defect. What CPT code is reported? You have options 14060, 11642, 11642, 15574. Now it is 1048. We will start discussing this answer at 1052. So if we get more answers, correct answer, we will start early only, no problem. So next week we have Chennai chapter, Chennai AAPC chapter free CU webinar. You can attend that if you want any CU. So we have only 9 questions here. So I think yeah, you are doing good, Manjur. So we'll discuss the answer now. So here also our diagnosis is basal cell carcinoma on the right nose and have reconstruction with an advancement flap. So basically here is the one important guideline. So what is that is? Based on CPT guidelines, when physician performs adjacent tissue transfer along with excision of benign or malignant lesion, we need to code only adjacent transfer tissue code. We will not code excision code. So because of that reason, our answer is 14060 as our your diagnosis basal cell carcinoma. This is one type of malignant cancer. Here physician has excised and physician has performed adjacent tissue transfer. So here we need to code 14060 as we will not code here excision of malignant lesion. We will check the code once. 14060. See here, adjacent tissue transfer or rearrangement, eyelids, nose, ear and lip defect 10 square centimeters or less. So here also you need to remember it is mentioned in 10 square centimeters. Sometimes you need to convert centimeters to square centimeters. See here, physician has performed 3 square centimeters only here. So because of that, our answer is 14060. So thank you Manjur and Prasanjit. You did a good job. So today's last question. So 44-year-old patient had an abscess by her vulva which burst. She has developed a soft tissue infection caused by gas gangrene. The area was debrided of necrotic infected tissue. All of the pus was removed and irrigation was performed with a liter of saline until clear and clean. The infected area was completely drained and the wound was packed gently with sterile saline, moistened gauze and pads were placed on the top of this. You have option 56405, 10061, 1104, 11042. So now it is 10:53. We will check the we will start the discussion at 10:57. So last question of the day today. So whatever you know the answer, you can mention there. So there is no negative marking here. You can write whatever you know. There is no restriction on that. So we will start the discussion now. So patient had an abscess of vulva which burst. So it is already open. So burst means it is already open now. She has developed a soft tissue infection caused by gas gangrene. Because of that, the area was debrided of necrotic infected tissue. All of the pus was removed and irrigation was performed with a layer of saline until clear and clean. The infected area was completely drained and the wound was packed gently with sterile saline. Moistened gauze and pads are placed on top of this. So basically two things we need to remember here. So based on our question, abscess is already burst. So there is no need for incision here as it is already burst. So here we can eliminate 56405 and 10061. So we are left with C and D 11004, 11042. So here physician has performed debridement for necrotized infected tissue. So 111004 will check. So if we check 11004 debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing soft tissue infection, external genitalia and perineum. So what is your keyword here? This one, necrotic infected tissue. So this is the keyword. So you need to remember here. So because of that, our answer here is 11004. So I hope this session is very useful for you, and try to attend tomorrow also. Tomorrow also we have. Thank you, Srinath, Prasanjit. So we will wait for few more minutes. So if you have any doubts, please mention in the comment section. Tomorrow also we will try to have one more session. If it is possible, I'll attend tomorrow also. There is no restriction. So I will give you 5 minutes. After that, we will start this session, and we will meet tomorrow again. If you have any doubt, you can ask now. If otherwise, if you don't have any doubt, we can stop it here itself. Thank you, Manjur. I hope this session is useful for you. So encourage your friends also to attend these sessions. So we are providing these sessions for free only. So no need to worry. So if they can't attend at this live, ask them to watch after the live session also. These videos are available for public tomorrow, not today. And also attend tomorrow session also. We will have same timing at 9:15 p.m. IST. Attend tomorrow also. So guys, any doubts? So if you don't have any doubts, without wasting your time, I will close this session. Thank you, Manjur. Thank you very much. Yes, you can attend and watch previous sessions also, which are already in the Passport 21 channel. So you can check the YouTube live playlist. There you can find all these sessions. So if you want to know more updates, join in our Telegram group. So where you can find free videos and jobs. So you will get job notifications from USA, UAE, Dubai, India, and sometimes Philippines. No worries, Prasanjit. I told you already, just I want to share my knowledge and gain knowledge. So if it is useful for you, that is good for me. I will be feel very happy. So now I am happy. After starting these sessions, two students told that because of these sessions, not completely helpful, but they will have good idea. Yeah, yes, Manjur, you can watch all those videos. So you watching those videos only, those guys passed the CPC exam. So no worries. If you have any doubt while watching those videos, mention in the comment section. Otherwise, you can send to vincentmedicalcoder@gmail.com. So personally, I will clear all your doubt. So whenever there is a confusion, send message to vincentmedicalcoder@gmail.com. As soon as I possible, I will try to rectify your problem. So in our Telegram group also approximately 1100 coders are there. In our WhatsApp group, nearly we have 3000 coders are there. Srinath, no worries, just watch our videos. At any time, those are helpful for you. So basically, so people are passing using these sessions, not completely, but these sessions are useful for 20 to 30%. So if you want any CPC training, complete CPC training, I will try to help you by providing the contact number. So I think coming week we are going to start one CPC session. So if you are interested, you can join. So irrespective of that session, that is paid session, this is free session. You can attend these free sessions whenever you want. So if you want pass dedicatedly, you can watch our previous videos. Those are most informative and most valuable videos. You can watch those videos. Surely you will get pass. So as I have mentioned previously, I will explain the keywords and I will explain what is the reason to choose the correct answer. So tomorrow onwards, start using those videos first. Then you can pass surely. Okay, guys. Then I will stop the session here itself. So if you have any doubts, you can ask tomorrow also. Tomorrow also we have one session. Thank you, guys. Good night.